It's an interesting discussion that I've been having with a lot of people at the conference. I think the differentiating factor here is really the in-person field component that uses the TB data for action method. Um, Even for myself, I had read the papers that Einar and Rita had written about that field component, and I didn't understand until the time I saw it. And I have to tell you, all I could think of was if I had seen this, learned this 15 years before, every one of my grants would have been more successful. And I really have thought a great deal about, can we make that into a non-person spot? But the fact that you go and you sit with the TB clinicians and you see how they use the data day to day is just something that you don't find in any other course around the world.
Yeah, I think it's a great course in the sense that most of us as program managers, especially those that came in the past 10 years, only have mostly theoretical experience. They read from the books, they learn residentially, and that practical component of learning is deficient. So this particular training kind of exposes everyone to the practical aspect that is deficient. People begin to see how the data that they use is generated from the community to the health facilities, what tools are used to capture, and they look within those tools and make analysis and see where gaps are so that they can identify and improve the generation of data from the community. And at the facility itself, you see that the recording and reporting tools are there, but because the learning is mainly theoretically based, some key analysis are not happening. So because of that, the training now comes with those kind of analysis and shows the program managers what to do. Because if you send a program manager to supervision without the practical experience, he will look at the records and see the completion, but will not go through indicators or try to see whether the data makes meaning. So this is what comes out of this particular training. So we have learned more on how to interpret this data. We have learned more on how to see the interconnection between the dot center, the laboratory, and then the other departments where you have TB screening taking place. And we've also learned how to interact more with healthcare workers so that you can identify gaps in knowledge and then see how you can train them even on the job, not waiting to go to a residential, because training them within the facilities using the gaps that you identify as the starting point is one of the best ways to make things stick in their mind. So I think this training is wonderful, and I wish that program managers across developing countries, high burden countries, will have the opportunity to participate in this training.
The union provides a wide variety of information. From the beginning of tuberculosis, which is the infection of tuberculosis, formerly called LTBI, the diagnosis and then treatment, to the most complex aspect of tuberculosis, like special population affected by tuberculosis, like children, pregnant women, HIV or HIV, and other infection or other medical complications. But also the new comer in the world, which is the drug-resistant tuberculosis. So the union also provides all these different courses and is in the cutting edge of the medical information of the new development of drugs and diagnostics. So the union is a perfect tool to get all that information.
Target audiences of our courses are very important to be covered. We start primarily from products that are earmarked and focused on TB professionals and TB and health officials from low and middle income countries with high TB burden. And the principles course in particular is really a foundational course for all NTP, National TB Program staff and officials, but not limited to TB professionals. or TB coordinators and TB focal points. I would recommend that also personnel from national laboratories, especially TB laboratories, radiology departments, health information system or health information officers, and persons who are interested in gaining more information, knowledge, skills, and competencies about TB would consider registering and joining our principals course.